to assist them. So accepting his invitation, I went with him on Monday and Tuesday, and I was there with the IRC Commissioner in General, Sam Coim, who is also the chairman of the Western Highlands Provincial Health Authority. We went there as a team. The leading group in Bagolong, and it's an important team that we went. While there, we visited some of the health facilities. That will be a report coming through on where they are and what needs to be done. Department of Health is working in partnership with the Western Highlands PHA on how to address some of the gaps that we identified in the healthcare delivery system. But for now, while visiting there, we went to one of the health centers. It's Boca Pena Health Center. The MulBaiya, part of the electorate. We were requested by, I was requested by the CEO of Western Highlands PHA change, and especially from an obstetrician there by the name of Dr. Tony. He requested for us to see one of the concept that they were introducing, generally to address the need to have more mothers coming to health facilities to be supervised, to have supervised deliveries by trained health workers. And for that to happen, they established they call it a Malolo House. It's a house, Malolo House, a resting house, for mothers to come in before they deliver. So that's the purpose of the particular building. It's similar to the Goose House type, and in there you have good sleeping facilities. They have mattresses in there, pillows, and they have bags for babies who will be born, and the mothers, and even gifts for fathers who actually bring along their wives to deliver at the health center. To address, because today PNG still leads the number of mothers or maternal mortalities, number of mothers dying during childbirth. It's still a problem in our country. We actually we have improved in our statistics generally, but we're still higher than the other Pacific Island nations. So it's still a concern. And what they have done, looking at the statistics at the Western Highlands PHA, many mothers who still want to deliver outside or in the remote, in the villages, and that actually resulting in high number of mothers dying during childbirth and high number of babies dying during childbirth. So what they did is they want to build this kind of house Malolo or Malolo house to encourage mothers to actually come there. When they want to deliver, they come there, they stay for 1 or 2 days, and they give some gifts to the mothers who actually come and use the facility. When they are there, they are comforted, they are advised, they are checked properly, and the important thing is they have supervised deliveries. They deliver in the healthcare facility, and they are properly supervised by health workers. In that regard, they are reducing the number of mothers who are dying during childbirth, and the babies who are dying also during childbirth, during deliveries. So this is housing by opening here. It's a Malolo house for mothers to come in. You don't expect to see a permanent building there. And this is a concept that's done by Western Highlands PHA, and I'm asking the PHs in all our PHs to have, especially mothers who are coming from the remote parts of our communities, to also have this kind of facilities there. They were asking, why the member in a support team? Actually, the member gave them an ambulance. When you were the member present, a new ambulance, replacing an ambulance that was used for the last, I think, 4 or 5 years. Now, you decide. Ambulance by giving first, because you could not hold stuff, we go like it. Or by billing, you wait long money, long come the billing on the travel house. Good house. Lord Mama come sleep, just to sleep and wait for the deliveries. What do you decide? Which one do you choose? So, I actually support that program. We play no foul line no gonna kati report natin lo ambla house kuna yo the concept, the aim, the purpose of the particular building. Emi maskisim trumla tok. It has to be emphasized over and over again that we are now doing what we need to do to reduce the number of mothers dying during childbirth, dying during delivery, so that childbirth, and the number of babies who are dying today. We still have statistics. We're still leading in our region, in our South Pacific Island nations. We're still leading. We may reduce. Before we have 400 and something out of 100,000 mothers who are dying, who deliver. and bloody more than 400 a died before. Per 100,000 mothers delivered. Today the numbers now reduced to 171. 171 per 100,000. The number go down now for the first time. Because plenty road now company club dinim plenty community blow yemi. Na plenty man now got access to health facilities blow yemi and stuff. So the number is actually reduced to 171 now per 100,000. And when we do this kind of interventions, these concepts, Kunai Haus, right across all these health centers, the people boost mountain. Don't need to carry more kappa now making plenty house now. Mama got diet. So we have this Kunai Haus there. So some people who are good at Facebook or TikToks, and these are busybodies.
It's caught in the crossfire.